Hello everyone, welcome to my channel, The Tooth Fairy, and our today's topic is dilaceration. In history, they use terms such as scorpion tooth or hand of traffic policeman for dilaceration. To me, it looks like these teeth have knee joint problem. Since tooth has no knee joint, what it is dilaceration. So you can clearly see here there's an abnormal bend in the apical portion of the root, apical third portion of the root. Ideally, this is the long axis of the tooth and this is the dilacerated portion of the root axis. So there is a change in linear angulation of the crown and root. So dilaceration is an abnormal bend and it can occur both in root or crown portion of a tooth. The root is affected most frequently. If it is root dilaceration, it is common in maxillary premolar area. If it is crown dilaceration, it is common in maxillary incisor area followed by mandibular incisor. Also, it is found in both primary and permanent dentition, but frequently in permanent dentition. Now coming to its causes, it can cause due to any traumatic injury that occurs during tooth development such as avulsion. Avulsion is the tooth is pulled out of the socket, or intrusion, that is the tooth is pushed into the socket, okay, or due to any cyst or tumor or any retained primary tooth, any extra tooth. Now if you can see here, it's a crown dilaceration because axis of the root is okay but the crown is bent, okay. Then here is the root dilaceration, the apical portion of the root. Now root dilaceration is not detected clinically, that is obvious. So we take x-rays. Crown dilaceration can seen as an angular distortion clinically. So the root dilaceration does not affect eruption and tooth function, but crown dilaceration can prevent the eruption of tooth. Also, when the tooth erupts, it comes in either in labial or lingual position, so it hinders or it alters the tooth function. So when diagnosed radiographically, if the root dilaceration is present mesially or distally, the condition can clearly seen on X-ray. Like we can see the adjacent tooth. Like if you want to see 1.5, we can see 1.6 and 1.4 clearly because they are present mesially or distally. So if the roots dilacerate mesially or distally, we can clearly see. But if the roots dilacerate buccally or lingually, then the central X-ray which passes, it is parallel to the deflected portion. So we see the dilacerated portion as a bullseye, like a target. Okay, the target lesions are also seen in erythema multiforme. So we can see here this is the dilacerated portion, okay. Then we have a radiolucent center, that is apical foramen or the apex, and then we have PDL space, okay. So this is dilaceration if present labially or lingually. Now management. If there is minor dilaceration which is not bothering its function, so it requires no treatment, but it can complicate the extraction procedure. It can also complicate endodontic treatment since taking working length or working on a bent tooth is difficult, okay. So it can cause a problem while using it as abutment tooth, that is a supporting tooth for prosthodontic. It can also pose a problem for orthodontic treatment. And then dilacerated crown, they can be restored with full coverage crown to improve aesthetics and function. And if it is grossly deformed, then it cannot be restored and it may require extraction. Thank you everyone for watching this video. If you like the video, please hit the like button and share, and also subscribe to my channel. Thank you.